Hello friends, this is again Dr. Ibrahim with a new video on coronavirus, its diagnosis and some misunderstanding about its diagnosis. So let's get started. As we know, coronavirus is still in the environment and it is still going non-stop throughout the world in America, Pakistan, India and rest of the world. The only one thing that we can talk about is the vaccination. That has started, that's a good thing. But as I said in my previous video, that the vaccination is only given to the priority groups. What were those priority groups? Like the elderly people and the age more than 65 years with multiple medical conditions, residents of nursing homes, first responders, including doctors and nurses who have interaction with the patients. These are the priority groups who have been receiving the vaccination now, and how long it will take for the general public to be vaccinated, we are not sure. We cannot say any word about it, but as of today, what I can think that it will be a couple of months to get the vaccination for the general public at least. And if it happens in a couple of months, it will be very fortunate. Now we are going to talk about the diagnosis of coronavirus. First, we talk about the current infection. If we have to make a diagnosis about the current infection, where you have the sign symptom or you have been exposed, what will be the diagnosis? The first test will be the PCR test, that is called polymerase chain reaction. This is a confirmatory test. And the second test for the current infection will be rapid antigen test. This is not a confirmatory test, this is a probable test, meaning that if you get this test positive, you have the disease. But if you get this test negative, not necessarily you don't have a disease. So this is a probable test. Now we come to the past infection. People ask these questions that, oh, we think we have been exposed, but we had no sign and symptom. We surely got this disease, but we want to know what we can do. So the answer is you can get this antibody test done for you. The antibody test is for the past infection. What are the antibodies? These are the IgG and IgM. If they are positive, it means that you have been exposed to this disease and you had the infection in the past. Now coming two things about the PCR test. These are the big misunderstanding and that needs to be clarified for you and for the general public. And I would like to stress on these 2 points. Please note down these two important points. The PCR test should not be done very next day of exposure. People go to the test and think that they have the disease because they attended a party yesterday and the test is going to be negative. Yes, for sure the test is going to be negative. Why negative? Because the virus takes a time to replicate in your body and it takes at least 5 days for any test to be positive. That means that if you have ever been exposed to a confirmed case, meaning you have been within 6 feet distance talking to the person or and more than 15 minutes there in a party or close to a confirmed case, then you have to wait 5 days since that exposure day. After 5 days, yes, you can go for the test to be done and then the PCR test will tell you exactly that you have the disease or you don't have the disease. So please don't waste your energy and money just showing up for the test very next day or the day 2 after your exposure. Second point I would like you to remember that is very important is that PCR tests may remain positive for a period of 3 months. Yes, for a period of 3 months. That means that if a person was infected, then don't get that person retested for the PCR after a couple of weeks, thinking that, oh, I need to know whether my mother who was infected was PCR positive. and how she is doing now after 2 weeks and 3 weeks. So let's get tested and we will see that whether she's positive, if she's negative or not. She may be again positive. Why? The person may remain positive for a period of 3 months. The reason being that genetic material of the virus may make this test positive, right? So there's no need of retesting for the PCR test. It is not going to give you any clue whether the person is infective, whether the person is disease or not. So according to CDC, Centers for Disease Control in USA, after 14 days, if a person who had the disease will be called recovered, provided that person does not have a fever for a period of 24 hours and the sign and symptom have been improved. So after 14 days we can say that, hey, you can go out in the community, you are recovered, you are no more infectious for the other people. And the question whether I need to be tested again, no, you don't need to be tested again. The reason being, this test may be positive or this test may be negative. So the PCR test should not be done again. PCR test done for one time is enough for the patient. I think I made it very clear, these 2 points for you all, and hope you understand. If you have any comment, any suggestion, any question, please put in the comment section. I will try to make another video to resolve anything, any issue that you might have, and or any confusion or any misunderstanding that you might be having. So with this, I would say goodbye to you. Take care of yourself and your family as you have been taking care, and take all the precautionary measures related to coronavirus. Thanks for watching my video. Thanks. Goodbye.